Hello everyone, in this video we will see the anatomy of the heart. So this is the human heart. It is a hollow muscular organ and it is situated in the middle mediastinum enclosed within the pericardium. So this is the anatomical position of the heart, in which this is the apex of the heart, which is directed downwards, forwards and to the left. Now we see the external features of the heart. In the external features we have the apex. So this is the apex, which is formed by the left ventricle. This chamber is the left ventricle and this is the apex. Now the base of the heart. The base of the heart is on the posterior side and it is formed by the left atrium. So this is the left atrium of the heart. Then the surfaces. So first we have, this is the sternocostal surface, because it is lying in contact with the sternum and the costal cartilages. That is why it is known as sternocostal surface. This is formed by the right atrium. So this chamber is the right atrium of the heart. This is the right ventricle. This is left ventricle and this is left auricle. So all four chambers are contributing in the formation of the sternocostal surface. Then we have the diaphragmatic surface. So this surface is the diaphragmatic surface. Since this comes in contact with the diaphragm like this, that is why this surface is the diaphragmatic surface. And it is formed by the two ventricles, that is on the right side, that is this is the right ventricle, and on the left side by the left ventricle. Then we have the two pulmonary surfaces, that is right and the left pulmonary surface. The right pulmonary surface comes in contact with the right lung. So the chamber which is in the relation with the right lung, this is the right atrium and some part of the right ventricle. And the left pulmonary surface, this is formed by the left ventricle and this is the left auricle. So these are the surfaces of the heart. Then we come to the grooves of the heart. In the heart we have three types of grooves. First is the atrioventricular groove, which is between the two atria above and the ventricles below. So this groove is the atrioventricular groove. This lies on the anterior side as well as on the posterior side. So on the posterior side of this atrioventricular groove we have the coronary sinus. This is the largest vein of the heart. And on the anterior side it is having two parts, that is on the right side as well as on the left side. On the right side, this is the right atrioventricular groove. This is between the right atrium and the right ventricle. So this groove contains the right coronary artery and the small cardiac vein. And this groove is on the left side. This is the left atrioventricular groove and this contains the circumflex artery. Then we have interventricular groove between the two ventricles. So this is the interventricular groove. This groove contains the left anterior descending artery and the great cardiac vein. On the posterior side also we have a groove. This is the posterior interventricular groove. This groove contains the middle cardiac vein and posterior interventricular artery. Now last one is the interatrial groove. This interatrial groove is not prominent on the anterior side. On the posterior side we can see this is the faint groove which is between the two atria. This is the interatrial groove. So this is the inferior vena cava opening and these are the openings for the pulmonary veins. In between these two we can see the interatrial groove. Now borders. There are four borders in the heart. This is the right border of the heart and it is formed by the right atrium and part of right ventricle. Then this is the inferior border of the heart. It is formed majority by the right ventricle and part of left ventricle. Then this is the left border of the heart. It is formed by the left ventricle and the left auricle. And this is the superior border of the heart, which is hidden by the great vessels of the heart.